Hi, I'm Tom Bagwell, and welcome to Hello Health, a partnership with the Ochsner Health System and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight's topic, 3D printing, immersive technology, and augmented reality, and how they are being used in medicine today. Tonight's guest is neurologist and brain injury specialist Korak Sarkar. Dr. Sarkar did his undergraduate studying at Johns Hopkins University. He earned a doctorate of medicine from the University of California at San Diego. He completed his internship at Ochsner and a residency in neurology at the University of California at Davis in Sacramento. Followed that up with a fellowship in brain injury and medicine at Northwestern University's Rehabilitation Institute of Chicago. Dr. Sarkar is board certified in both neurology and brain injury medicine and rehabilitation, and it is our pleasure to welcome Dr. Korak Sarkar to Hello Health. Good to have you with us on the program.
Thank you for having me.
Yeah, and you're making history tonight. We're in a new studio. We're in Benson Tower here downtown. Moving from River Ridge and originally in Metairie, so you're part of history, so welcome to that as well.
Thank you. I feel privileged to pioneer this new space with you.
Very good. Originally from California, but have spent a lot of time moving around the country, and then a stint here in New Orleans, as we mentioned, where you actually met your wife, right?
Right, yeah, I'm kind of every transplant story I married in, and so now home is where the heart is, so here I am.
Very good. And we ask all of our first-time guests, what was it or who was it that first got you interested in medicine, and how did you end up in this area of specialty?
So I'm one of those kids early on. One of my first memories is getting a gift of a brain model, and from there I was just in love and studied neuroscience in college, pursued neurology, and then brain injury. It's amazing how well, the brain is not that great at healing, but amazing at learning and adapting. You look at any newborn, they go from not being able to do anything to walking, talking, and having a personality in a matter of months to years. And brain injury is the same way, where people can have miraculous recoveries, and to be able to be a part of that, to support that with a team of therapists and nurses and social workers, it's really fulfilling. And in this day and age, with the things that are happening in the NFL and all the soldiers returning from across the sea overseas, it's really needed.
We know a lot about the brain, don't we? But there are a lot of things we still don't know.
Oh, definitely. When sometimes patients walk in and I know exactly what's going on right away, and then oftentimes people come in and I have to scratch my head, and in that situation my job is not to figure out what's wrong, it's to make sure that there isn't something wrong, and there's just a lot of things that we don't understand. I could name a few things that we know we don't know, but who knows how much we don't know about the brain.
Do you even remember the term 3D printing when you were first entering medical school? Are you surprised at how far we've come?
Yeah, even in this day and age, if you use the term medical additive manufacturing, 99% of physicians wouldn't really know what that means. So we're really at the bleeding edge of something, and definitely when I was in medical school, I wasn't aware of 3D printing.
Well, most of us have heard about it by now, but most people probably haven't seen a 3D printer or operated one. So let's talk in general terms first. What is 3D printing?
That's a great question. So 3D printing is actually called additive manufacturing. And so when we talk about manufacturing, when you hear it about on the news, or politicians are talking about manufacturing bases or the manufacturing jobs, they're actually talking about subtractive manufacturing. And that's a kind of a fancy word, but basically the best example of that is sculpture. You take a piece of marble or a stone, you have an artist like Rodin that chips away, subtracts material, and creates the eternal springtime. In additive manufacturing, it approaches it differently. Instead of chipping away material, it actually lays down layers to create a 3D object.
And just think of regular manufacturing too. You buy a shirt, it started with a big giant piece of cloth and was cut into something much smaller. So how does 3D printing work? It's not just plastics, right?
Right, exactly. So 3D printing or additive manufacturing is what I call a platform technology. And what that means is there's a lot of ways to skin a cat. And so the most common type is fusion deposition molding. So a lot of you may have even bought your kids a 3D printer for Christmas or recently, and that's the most common technology used by Makerspace, MakerBots. And basically that's a hot glue gun that lays down layers of hot plastic layer by layer to create an object. There's also something called stereolithography. We have one of those printers, and that uses a photoactive material and a laser or a light source to cure it. And I kind of joke, it looks like the bad Terminator from Terminator 2 coming out of the goo. There's also PolyJet, which is based on an inkjet technology, and selective laser sintering, which uses a high industrial grade laser to interact with even metals like titanium to create very specific, low volume, high fidelity manufactured goods.
I was surprised at how quickly the price of 3D printing has come down. Not the machines you're using at Ochsner, but the ones that parents are buying for their kid. You can buy them for under a couple of $100, right, at the very base model.
So when I started about 5 years ago just playing around with 3D printers, in the last 5 years, it's magnitudes of order, the decrease in price. One person told me, the more sophisticated the printer, the less sophisticated the user has to be. And so 5 years ago, I had to sit there, learn everything. It's like watching grass grow. And if it goes off by a little bit, that whole print is off. And if that happens in the middle of the night, you got to restart. And now the printers are getting much more robust and just have a lot more capabilities, and you can kind of bring them into desktops even. So it's really exciting.
Primary focus of tonight's discussion is how 3D printing and these technologies are used in medicine, but let's talk about where it's used in other places first.
Yeah, it's a great question as well. The 3D printing sounds very novel and cool, but it's actually been around for years, decades, used in spaces like the automotive, aerospace, defense industries, and now is beginning to be used in medicine.
We're going to talk about how it's used at Ochsner in a moment, but first we want to talk about how it's used generally in medicine.
So it's used in a variety of fields, everything from neurosurgery to craniomaxillofacial surgery, and it's used for a variety of things. I would say three main things at this point. One is patient education, being able to empower and engage the patient about what's going on. And then second is medical education. It takes years to become specialized and trained in all these different specialties. And these kinds of tools can bridge that gap or expedite that learning curve. And then finally, for very complex surgeries and procedures, like the ones that are done at Ochsner as a tertiary quaternary center, being able to plan. So the surgeon or the proceduralist can actually see what they're getting into before they're already in it.
How did you first get involved in 3D printing, and how are you using it in your work at Ochsner, and how are others using it at Ochsner?
So about 2012, 2013, I was finishing up training. I was at a brain injury fellowship using a CT scan, which if I showed you right now, if you knew it was a CT scan, it was a brain, that would be pretty impressive. And I had this epiphany that, I understand what I'm looking at, but looking around trying to explain this to the patient, their families, even the therapists and the medical students, they had that look of, I have no idea what you're talking about.
I've got to trust you. Right?
Yeah, exactly. Yeah. And I had that look on my face for many years, and then you understand after you've seen thousands of these. So the idea then, that's when the makerspace or the maker bots were coming out. They were becoming somewhat accessible at a consumer level. And I was like, I'll just 3D print this. Very naively, I'm like, I'll go home, Google it or Reddit it, and just figure it out. And that was definitely naive. It took a lot longer than that. But that's where it came. Is I wanted to be able to actually use this information and communicate it so that was as powerful to me as powerful to the patients and my colleagues as it was to me.
This is more of a general comment than it is with medicine, but they've always said job security is to know something that everyone else doesn't and to be successful in your work, to really delve in and become a real specialist in this. Do you see that as your role at Ochsner in some ways, the leader, the go-to person for this sort of technology?
And that's happened very organically, and it's interesting because this field brings, and we'll probably talk about this as the half an hour goes on, a lot of different kinds of people that traditionally don't work together. And so, I'm talking to neurosurgeons about very complex anatomy, and I'm a neurologist, so I understand what they're talking about, but to a degree, it's a little bit beyond me. And then I'm talking to video game developers and trying to communicate and bridge the gap, and even though I don't completely understand what they're talking about, I end up being the person that has the most proficient vocabulary to communicate with all these different people. So then by default, yes, apparently I'm the expert in the room, which is, you look around, you're like, okay, I guess that's me.
You talked about being a resident and an intern. You're a doctor, or they're calling you doctor, but you really don't know. You kind of pretend to know. With this, it's not like you can turn to other colleagues. The guy who's been on staff for 30 or 40 years he may not have even heard of this, or she may not have even heard of this technology. In some cases, that, I don't know if it's frustrating or not, but you're kind of out there in the wilderness.
Yeah, and that's why it's so much easier to show this than to explain it, because yeah, you start explaining additive manufacturing and immersive technologies, and people don't really get it. But the beauty of these technologies is that I put a model in your hand.
Like this one.
Right, and this is a spine, a low spine or a lumbar spine that had scoliosis. So you can see the curvature here is actually very pathological. And so if I showed you the original imaging, you would have no idea what's going on. And even I, for me to imagine it in 3 dimensions in my head, I'm pretty confident, but would I bet my house? I don't know. And so this takes that out of it, and it feels like a Gutenberg moment. All of a sudden, this imaging that, it's not for you, but say it was, that I took, that's for me. It's really hard for me to explain it to you. Now, all of a sudden, you're not going to replace me, but we can actually have a conversation about this.
I think you hit the key word in feel. I can hold that in my hand and feel versus just looking at a picture.
Right.
Right? Incredible. So this is something that was printed or can be printed?
It was printed.
Was printed
Yeah.
with a 3D printer.
We have another one here. So one of the areas that we work extensively in is with congenital defects and cardiac congenital defects, little babies born with abnormal hearts. And I'll be honest, for me, I'm a neurologist. I'm a neck and above doctor. So when I look at these images, I don't know. And these are very unique and abnormal anatomies. We have been working with Dr. Ben Peeler and Dr. Jessica Molodou, just phenomenal clinicians. One is a cardiothoracic surgeon, the other a cardiologist. And even for them, we do some of these. The one you're holding in your right hand, Dr. Molodou, it's like, I've never seen anything like this. And so to be able to actually see that, and then the one in your left hand, we were actually able to slice it in half so you could look inside the heart. So not only can you see all the piping and plumbing from the outside that can be abnormal, but oftentimes there's abnormalities inside the heart that the surgeon can't even see.
Maybe on a CT scan or an MRI or an X-ray, but never
Not like that.
Never like this. Wow. Talk about immersive technologies like virtual reality, and that's something probably a lot of us have heard of by now, right? And anyone can buy glasses for $29.99
Right.
or whatever. I think they're in the drugstore now. I can go swimming with sharks. I can be in the middle of the sky.
Right.
How is immersive? Talk about virtual reality and how it's being used in medicine at Ochsner.
Definitely. So even the terminology of this is still being kind of ironed out. So you'll hear immersive technology, but you'll also hear mixed reality, and basically it falls into 2 main categories. There's virtual reality, where you're completely immersed. You're off on the planet Neptune, flying with sharks, jumping from dragon to dragon. You're in a completely different place. And then there's augmented reality, where you digitally overlay some imaging or information over what you see already as reality. And the classical example of that is Pokemon Go. And so those are the 2 main components of mixed reality or immersive technology.
How is this a unique opportunity for New Orleans? I know, for example, that Baton Rouge is heavy into gaming.
Yes. So we can go back to the future. Cold, Chicago, Siberia, and you couldn't apparently just Google and Reddit and figure this out. So one of the most difficult parts or technical challenges is taking medical imaging and converting it into something that can actually be interpreted by a 3D printer. So I'm, going deep into the internet, asking anybody that would listen. Eventually, I'm touring this 3D printing startup that was pivoting into medicine. And there was a young gentleman, even at that point, he was much younger than me, doing the segmentation process, as it's called. And I just being a wizard. So I struck up a conversation with him, and he's just very informative. And I was like, where did you learn this? And he's like, oh, I was in video game development. And I think I had a bad poker face because I was kind of incredulous. He's like, we're generations ahead of you, you being medicine when compared to the video game development industry. And that just blew me away, resonated, and I kind of followed that away. And then you fast forward, I moved down to New Orleans about 2.5 years ago. And for the people that are in the know, they know, but a lot of people even in New Orleans don't know that we host one of the most advanced video game development verticals in the country. And so there are people here that are leaders in mixed reality, immersive technology. And so I did what any nerd does. I went to video game development meetups and met someone that was very helpful and now has become an important collaborator in our mixed reality work.
Mm-hmm. So for all you parents out there who are worried about your kids playing video games, these might be the next round of doctors, the next Dr. Sarkar in developing technology that's going to help save your life one day.
It's funny you say that. So going back to Chicago again. So again, I'm hitting my head against the wall. It's a dark room. I'm in a corner. I have no idea how to do what I'm saying I can do. So Chicago Public Library has a makerspace. So it's a lot of 3D printers. And so I go. And it was on the weekend, and there was a bunch of little kids there, not older than 10. They're so young that I don't even know how old they are, but between 6 and 10. And I'm asking questions, and out of the mouths of babes, they knew way more than I did about 3D printing. And basically were like, how do you not know this? So what the internet was to my generation is 3D printing is at least one of those things for this next generation.
And there's no fear with kids either.
Oh,
They're not
yeah.
afraid of breaking something. You and I are playing,
Yeah.
I'm working on my phone. I'm afraid I'm going to push a button and it's
Right.
going to blow up or start to
Right.
smoke. With kids, there's no
No.
fear.
No.
Right. Mm. By the way, our guest is Dr. Korak Sarkar. Tonight we're talking about 3D printing, immersive technologies, and how doctors are using that, doctors at Ochsner in particular, in the diagnosis and treating of patients. So how are we using this in those areas with patients?
So we had this really impactful case recently, a young lady with Down syndrome. Her name is Jelena. And she's about 6 years old, and there's actually a lot of things that are associated with Down syndrome, one of which is an instability in the joint at the top of your spine. It's called atlantoaxial instability, and it's a relatively rare thing, and we have a surgeon here who actually went to medical school in San Diego, just another random New Orleans connection. We all ended up here. And
Been a guest on this program, as a matter of fact.
Dr. Celestra?
Yes, in fact,
Yeah,
yes.
he's phenomenal. So I was like, would it be helpful for this to be 3D printed? And he was like, yeah. So we were able to create a 3D printed life-size scan or model for him, and which he was able to plan the surgery. And the greatest part was Jelena and her family loved the model so much they asked for it, and I was like, of course. So they had that over the holidays as a conversation piece, and I want to acknowledge them because they're just an amazing family. She's an amazing individual, and one of the other potential associations with Down syndrome is leukemia. So this young girl born with Down syndrome, battling this atlantoaxial instability, and then also battling leukemia, and just is one of the happiest, cheeriest individuals, and their family as well. And so it really hit home that, okay, this can actually be helpful in so many different ways.
We thank the family for allowing us to share the story and for inspiring the doctor who you shared with me. You find just the family inspiring.
Yeah.
Good for them. So how are the tools we've discussed tonight used in medical training?
Yes, so what we're working with the University of Queensland School of Medicine, which partners with Ochsner, to bring these tools to medical education. And this is fresh off the presses. Last week we had our first medical 3D, or M3D lab as we call it, hackathon. So we had we're working with the liver transplant team. They had a rare tumor case. So we had one of the physicians kind of present what that is, what the cancer was, what it means, how often it happens, how do you treat it. And then we had this actual surgeon talk about the idiosyncrasies of that specific case. We had a 3D printed model, so all the students and the surgeons could look at it. And then we jumped into VR so they could scale it, walk through the tumor, look at the blood vessels. And it's just very an easy and obvious, impactful educational tool.
So for surgical planning, but is there a way to also practice? So to plan the surgery, but is there also a way to, this is so intricate, maybe I better do this on a model first?
Right, and so this is a model of your cricothyroid. So we've all seen, that action movie or a MacGyver episode where someone loses an airway and someone has to put a hole in the neck to get an airway, and that's called a cricothyroidotomy. It's a rare procedure, but something specific physicians like intensivists and emergency room doc, they need to maintain their skills, and so they can use this model that we printed to practice that.
Any other local institute? We know it's being used at Ochsner. You told us about some of the ways. Anybody else using this technology or the combination of them locally?
So, as far as I know, we are the only institution that is leveraging additive manufacturing, virtual reality, and augmented reality. 3D printing itself is going from kind of bleeding edge to early adoption stage. So I'm sure there's other people here using it, but all three modalities and applying it to so many different diverse specialties, I think Ochsner is the only one. And I want to give them hats off. It's for them to have the clinical support and the institutional support is very forward thinking.
You're from California, and I'm sure I'm sure you like to travel.
Yes.
Is this the kind of thing? Are there conventions for this type of thing, and even beyond the medicine part?
Right.
Have you put in a requisition to go to a gaming convention, for example? Is that the kind of thing you would want to do?
So you can talk to my boss. I actually asked her today to go South by Southwest, and that's the kind of conference that brings all the people that would be involved in this together. You know, the health innovation people, the VR, AR kind of people, and then there's some cool music in the background as well, I heard.
I think you just asked again.
Yeah.
So we'll see how that goes. When we have you back on, we'll ask. So how's it being fostered? How's the work being fostered at Ochsner beyond having you on staff?
And so, again, I want to commend Ochsner, and specifically Innovation Ochsner. The M3D Lab is now partnering with them to really scale, which has opened up all kinds of doors and opportunities, the ability to work with all new and different kinds of clinicians, the School of Medicine. So they have been amazingly supportive, and again, still forward thinking. Like, you know, there's still people that haven't even heard of this, let alone, oh, well, let's invest and cultivate this. It's, we're on the bleeding edge.
Do you find other physicians coming to you to say, hey, I've got an idea, what do you think?
It's funny. Everything has an inflection point. So I was going around to anyone that would listen, and recently now people are coming out of the woodworks and like, oh, I heard you 3D print, and I was like, I don't even know who you are, but so word is getting out, and really amazingly, with the support of Ochsner Innovation Ochsner, we're able to deliver, and we're growing so quickly. Like every day, it's something new.
Is this the type of thing that is in medical schools now that doctors in training are getting, and will it become if it's not already?
So there's people that are using it, but it's far from standard of care. I mean, it's not that much different than it was when I was in medical school, and for people that went to medical school far before me, you know, you go to an anatomy lab and you dissect a cadaver, and that's how you, in some places you have simulation labs, but having all of these modalities, the additive manufacturing, the VR and the AR, there's very few places that are actually applying all of those.
It's the kind of thing you've already lobbied for a trip to South by Southwest to pretend to be doing all the other stuff, to listen to some great music in Austin. Is this the kind of thing Ochsner is a teaching hospital? Will you be lobbying for this sort of additional training at Ochsner? Do you see the value in that? How would you be a better doctor today had you been studying this 10 to 15 years ago?
It's amazing how engaged the medical students and the residents and the trainees are. You know, that process is basically 24/7, 10 years of drinking from a fire hydrant. And so getting extra knowledge or having to do extra things, it becomes difficult. There's a lot of inertia, but the students love this. They're like, oh, this is great. This is the coolest thing. And so you don't even need buy-in. The buy-in is implicit. And so I can't imagine it not continuing to grow as a part of medical education here and maybe beyond.
Let's talk about if we had you back on the program 3 to 5 years from now. So we've made all the strides, especially in the area of 3D printing and virtual technology. Where would we be 3 to 5 years from now?
That's a very interesting question. There's three main areas that us, along with other people, are really pushing. One is this idea of co-immersion. So you can be in a virtual environment swimming with the sharks in Neptune, and if we were co-immersed, I could put on a VR rig and as well be in that environment. Now, if we're physically co-located, that's cool. We can share this experience. But if we're physically not co-located, I'm back in San Diego to visit a friend, and I need to talk to you about a case. We could, with a VR rig and just Wi-Fi, simple Wi-Fi, be co-immersed in the same environment. Now, there are some technical challenges to that, but we're beginning to explore that. Then in augmented reality, the goal is to actually be able to bring that into the procedure. So one of the people we've been working with is a vascular neurosurgeon, looks at complex aneurysms, so deep within the brain. And we were able to use a Microsoft HoloLens, an augmented reality platform, to actually be able to project that aneurysm onto me. We didn't use it on the patient, but you can imagine one of the arts of being a vascular neurosurgeon, way before you cut, is positioning. You want the head extended and flexed just in the right way so that you can have that perfect approach, and being able to visualize what you're going for before you have to do that. For people that are vascular neurosurgeons, that's what they train 10, 15 years after college to be experts in. But if you could expedite that learning curve as well as apply that. And then finally, this is not something that we're playing in, but the idea of bioprinting. And that's, can you print an organ? And we're far from
So you've stolen my question,
Yeah.
but here it is. This is a 3D modeling of a heart, right?
Mm-hmm.
Will there be a day we'll be printing one of these
Right.
that can be inserted into a patient who has a failing heart?
And so we are far from that, just to be clear, but there are already uses of bioprinting. There's two main ways. One is organ on a chip. So you can put a nerve on a chip, you can put a heart cell on a chip, and start manipulating and understanding to some degree how a heart and a nerve would work. And the other is building biofabricated scaffolding. And so one use case that came out of University of Michigan, there's a disease called subglottic stenosis. It's a congenital disease. Kids are born with a narrowing of their trachea below their glottis, and University of Michigan was able to bioprint scaffolding to stent that. And so, again, we're years, if not decades, away from printing new hearts and liver. So, adhere to the Mediterranean diet, exercise, sleep right, and don't drink too much. But yeah, that is in the future.
We'll look forward to hearing about it whenever that happens. Thank you so much, Doctor.
Thank you.
Been a great guest. Thanks for helping Chris in our studio.
I appreciate it. Thank you for
All
having me.
right. I want to thank the doctor, Dr. Sarkar, for the education and information he's provided tonight and for his work in the Ochsner Health System. To make an appointment with any of Ochsner's physicians, including tonight's guest, Dr. Korak Sarkar, or to register for any of Ochsner's Hello Health seminars, you can call Ochsner at a number set up just for viewers of this program. You can also send us questions by email, hellohealth@ochsner.org. As a reminder, you can rewatch tonight's presentation or any of our Hello Health programs on Ochsner's website at ochsner.org. Just type Hello Health in the search areas and that'll get you started. Our thanks again to tonight's guest, Dr. Korak Sarkar. Thanks to Humana and Ochsner for making our program possible. Thanks to the crew here in our new studio at Benson Tower. And our final thanks, as always, is to you for your support of our program, Hello Health. We'll see you next time.